Hi, Dr. Del Grosso at SF Chiropractic. I want to talk a little bit today about something called subluxation. Actually, the reason most people, or you should be coming to the chiropractor, you go to the chiropractor and a lot of times you've gotten in an accident or you've injured yourself or you've had some back pain for a while. And I don't know that everybody really understands, honestly, a part of why you're here or what we do while you're here, okay? We do therapy, we do a lot of different things. But one of the premise and the main premise behind what we do is something called subluxation. By definition, subluxation means that a bone has lost, the definition is a bone has lost its juxtaposition with the bone above or below. Basically means that it's shifted, it's out of place, it's not in good alignment with the bone above or below in your spine. Now, a result of subluxation can be a lot of different things. Subluxation itself, for the most part, doesn't cause the pain. It's the things that are associated with it that cause you the pain, the discomfort, the radiating pain, the tingling, the numbness, all these different things. Remember, it doesn't take a lot. When we talk about a bone losing its position or going out of place, we're talking about millimeters, just small amounts of movement. But those small amounts of movement have an effect. They affect the receptors in the joint. They affect a lot of different things. And the subluxation itself, those bones moving out of place, is very straightforward, is a very simple thing. But everything that happens that causes you the problems is very complex because there's a lot of things that occur. One is when that bone shifts a little bit, when it's out of place a little bit, you have little receptors in the joints that give position where your body's supposed to be, the way things are. And when your body notices a little shift, something different, those little joint receptors pick that up, they send it to your brain, your body has a response. And what's that response? One of the responses is for muscles to tense up, for things to tighten up, to make some change there, to splint, to guard, to make sure that there's no further problem. Okay, another thing that can occur is just a little bit of movement as those muscles, those little intrinsic muscles and stuff, when they go into spasm, they swell, can start to put a little pressure on a nerve. Okay, those nerve roots are important because remember, your nerves are like phone system, okay? That's what carries electrical impulses and messages from your whole body back to your brain and then back out again. So when those messages aren't exact, when there's a little interference there, when there's a little cloudiness, just like you get on your phone and it's not sounding real good, those messages don't get there, it causes problems. It causes aberrant effects or things that act the way they shouldn't be. Okay, so remember, subluxation is a big part, and that's the number one thing. Even though you're here and we do the therapy to help the muscles relax, we do a lot of things. A lot of that's to deal with the symptoms or with the things that are causing you the pain or causing a lot of the discomfort. But the truth is, at the end of the day, the number one thing we want to do is we want to make sure those bones are back in alignment. We want to make sure things are like they are, because if we don't get to the cause, all we're going to be doing all the time is treating symptoms. And that's why it's so important when you go to your chiropractor, if you come to us, we'll get you some kind of schedule. You need to stay with it because it's important not just to get you feeling better, but actually to go after the cause, to fix the problem, to make the changes so these things don't keep recurring again. And then once we do make the changes, to help you strengthen and give you things to do to kind of maintain and stabilize that, so that you don't have problems down the line and it's not long term. And that's why the whole idea of the maintenance come in every once in a while. Let's check it, let's take care of it, let's make sure you've got good mobility, the bones are staying in alignment, that everything looks good, okay? Because remember, mobility and function are the number one things when it comes to dealing with the spine, okay, and the nervous system. If you have any questions at all, if you have anything, please give us a call or come into the office, see us. This is Dr. Del Grosso, SF Chiropractic. You have a great day.